Can everybody hear me?
Yep, we can hear you.
Okay.
Yep.
I can hear you.
Hey, so apparently all of my folks are running a little late tonight, so maybe give them a couple more minutes and then you can get started.
Yeah, no problem.
This is live. Okay. I'll go for it.
I think you're okay if you want to go ahead and get started just with introductions, and some of the other folks will come meandering in.
You sure? Okay.
Yeah. And you're recording, so for anybody that joins late, I'll be able to send the recording to them.
Okay. Well, I guess thank you everybody for joining. My name is Tapley Holland. And I am the CEO of Bridging Biosciences, and I created the TruDose technology and uncovered the TruDose therapy. And so what I'm going to explain tonight is basically, why this technology was created, how it led to this treatment discovery, and maybe just talk a little bit about why platelets within our own blood can heal us from these different conditions that many people consider not treatable. Talk about how what we've seen, and then open it up for discussion. So if I would start off by saying, if we can all agree that we were created with the ability to heal ourselves from cells within our own body, then why have we yet to unlock the treatment discovery and healing power of these treatments? Because you can go on the internet right now and you can find these treatments and find studies that say, yes, these stem cell therapies or whatever it is do work. And you can also find studies that say that they do not work against, let's say, saline control. Why is that? Well, the reason that has been the case for even the past 5 decades is because of something of what I put my finger on, and that's dosing inaccuracy. And dosing inaccuracy is very easy to understand when we're taking medications. You give 2 Advil for a child and 6 for an adult, or whatever the dosing studies that were done to show what would make this person heal. But when you talk about stem cell therapies, and I'm just saying cells from your body to treat your body, when you think of stem cell therapies, scientifically, they've never really thought about dose to outcome relationship as it relates to, well, how many cells does it take to heal this condition, to heal that condition? And before I get on to say how I solve that problem, let me kind of illustrate it for you. So the easiest thing to talk about is a therapy called platelet-rich plasma. Now, what platelet-rich plasma is, and it's the most longest standing, widely known I'll call it cell therapy that's existed on the planet. There's been more studies published on its efficacious and safety and effectiveness than probably anything that exists. And what platelet-rich plasma is taking blood from your body and processing it in a centrifuge to separate out the components. So when you do a centrifugation process of blood, it separates the heavy red blood cells from basically everything that's lighter in the blood that's not the red blood cell. And you remove the red blood cells over here, and then you take all the other stuff, which is basically the platelet-rich plasma, and then you treat yourself. And some of you have probably already had this before. You maybe had a hair treatment, you've had it on your face, maybe you've had it in your knee. Those are the most common applications that you would find platelet-rich plasma. So, and again, it's one of those therapies where you can find studies that say it absolutely works. And you can also find studies that say it does not work. So why is that? Is because if you've had a platelet-rich plasma treatment, what would happen if, let's say, all 6 of us were to get a treatment and we were to all walk into an office and to get a treatment because we all had a hurt knee. And let's pretend our knee is the same injury. It's the same damage. The way that this PRT treatment would be executed is they would take, let's say, 20 mils of blood from the person in the upper left-hand corner, 20 mils of blood from me, 20 from Joanne, 20 from this other person, and 20 mils of blood from everybody on this Zoom call. They would put that 20 mils of blood into a centrifuge. They would process the red blood cells, take away the other stuff I talked about, and inject it into our knee. So the question is, does it make sense that if I took the same amount of blood from everybody, knowing that we're biologically all different, does it make sense that we're all going to have the same treatment success? So the intuitive answer is hopefully no. And until I really kind of articulated it and illustrated it like that, the idea of, well, that's dosing because I'm biologically different from you and you different from her and so forth. That is dosing. So what I did is I solved that problem. I solved that problem by saying we should be testing each person prior to, when they come into the office. We should take a finger stick of their blood. We should measure it, and we should use computer software that has a whole lot of variables built into it that's measuring all these different things that affect biology and affect healing. And say, knowing all these things and knowing your biology by taking a finger stick and measuring it, what is the exact amount of blood I need to pull and draw from me, from Joanne, from this other person, and each one on this call? Let's say for me, you got to draw 101 mils. For this Joanne, you have to draw 42 mils. And from the other person, you got to draw 86. But when you process all of our blood into a centrifuge, we each and all will have the same dose per mil that my software has determined will heal that knee. So I solved that dosing problem. And then once I solved that dosing problem by saying, we're going to personalize these treatments by giving you, this is the individualized blood draw you need to have to heal this knee condition for this person at this time that they're at. I said, well, what happens if we inject this intravenously? Which nobody had been doing that at the time in the literature. And that's kind of when it unlocked Pandora's box and really changed the course correction of my company and really everything. Because when you take this blood out of the body and you give it at the right amount, and then the software over time has figured out the right amount for all these conditions you can think of, autoimmune, autoinflammatory, Lyme, COVID long hauler, you name it. If we take this blood out of the body and we process it at the right dose and we infuse it intravenously, what has happened close to 7,500 patients and close to 5 years later is I can say that it's unlocked the healing potential of reversing and halting these various disease conditions from something as simple as their own blood. And So the next question well, how is it doing that? Because I created the software and the testing platform that solved this problem that's existed in stem cell therapies as a whole for decades. And then I went ahead and said, let's go ahead and do this intravenously. And now I've uncovered all of these disease conditions that are being treated, and not just treated, but actually being reversed. And not because people are saying they're getting better, which they are, but measuring at their brain level, at their blood level, that these things that were there are no longer there, that the liver that's chronic and needs a transplant no longer needs a transplant. So how is that possible? How is taking blood that's nasty and it's trashed, and you take it out of my body and you put it back into my body? How is that even working? Well, I'm going to share my screen with you and tell you how it's working. So this is what we call, let me back this up. Sorry. This is the healing cascade, or this is what we call our body's repair system process. And our body has two processes that it manages that help us live a long-lived life. One is this, how we repair ourselves, and the order of events and how we repair ourselves. The other one is our immune system. And our immune system, which we largely think is your white blood cells, it undergoes a very similar process of sequential order in which how it tackles things that are not supposed to be in our body. So with this repair system right here, stage 1, I have to identify that there is an injury. Stage 2, our body signals for this inflammation and white blood cells to come into the area. Stage 3, I have to make sure that there's enough blood flow. Stages 4 and 5 is when I'm actually ready for stem cells, because the body says all these things have to be satisfied. They have to be checked. And the body does not go to the next stage. I don't know how to stop that. The body does not go to the next stage until these events are checked. So if you look to the left, you can see what's governing this entire process, and that's your body's platelets. Your platelets are circulating your bloodstream, looking for things that need to be repaired, and when they see it, they activate this process, and they're intimately involved with it. But the problem is that when we get down to the end of stage 5, if this time clock is not, but the body also initiates a time clock that it expects you to initiate a repair. Even as we're standing here right now on the Zoom call, our bodies are undergoing this same process. You're just not feeling it. So if this injury, let's call it a brain injury, the body gives it a time clock, because the body gives us resources, it gives us cells, it gives us all these resources it allocates, and then it gives it a time clock. Well, if this order of events is not completed by the time clock, the body, what it basically does, okay, now I'll go to this one. The body pulls these resources back, and the injury, let's call it the brain, or we call it the knee, like we did earlier. What happens is this knee or this brain stays stuck in this inflammatory loop that it can't exit out of. And this is how we get chronic inflammation. This is basically the knee or the brain saying, whoa, you're not done. I'm not done healing. Come back. I need help. I need help. So all of these white blood cells are rushing to the scene of the crime, but they have nobody directing the traffic, because the platelet has already moved on, because the platelet is the one that's directing the traffic. It's telling the white blood cells what to do, when to do it, how many they need. So this is an inflammatory loop that your body can't exit out of. And as we age, these inflammatory loops become harder and harder to exit out of. And so what happens is, before I go on, and so your immune system has a very similar sequential process. Your platelets are actively circulating the bloodstream, identifying, in this case, not things to repair, but things that should not be in the body: viruses, bacteria, mold, fungus, etc. And when it identifies things that shouldn't be in the body, it releases a whole arsenal of things to prevent viral replication, to prevent bacteria from spreading, it's responsible for clearance. So the white blood cells are the things that do the heavy lifting, but the white blood cells don't even know what's happening, who's attacked the body, or what to do until the platelet actually says, I've got a virus here. I've got it under my control. I need your help. I need your help right now. So platelets are constantly circulating around, and they're literally, in my opinion, the most important thing circulating in your bloodstream. But if you were to look into the literature and you were to research what's the function of platelets, all you would find is that the platelets are only responsible for making sure that we clot and we don't bleed out. So you have your immune system and your repair system. And again, if your body cannot clear a virus, it cannot clear a bacteria, in a very similar fashion, the platelet, has to move on. And now that virus, that bacteria becomes stronger because it already surpassed your body's defenses. And now your body learns to coexist with this virus, this bacteria. Your body learns to coexist with this unresolved repair that it can't get out of. And so what happens is, and this is the data that we've kind of accumulated, is that, what happens is that you get stuck in this inflammatory loop of repair, this inflammatory loop of immune defense. And what happens is, let's see if I can draw something. I know there's a drawing. Okay, here we go. What happens is you get stuck in these inflammatory loops that you can't exit out of. And then you get to this point right here. This is the metabolic tipping point. This is the metabolic tipping point right here. This is the point to where you are teetering on going into neurological decline right here. And what does that look like? Brain fog, fatigue, fine motor loss, beginning stages of MS, memory loss. And if you don't get this treated, if you don't get your body out of these inflammatory loops, what happens is you'll start to cascade down towards this. This is where you turn into advanced stage ALS, advanced MS, autism, schizophrenia, etc. So going back, why does this treatment work? Let me see if I can back up. Why does this treatment work? It's making me stuck in my, there we go. Because what this treatment does is you're concentrating the right amount of platelets, you're taking them out of the bloodstream, and we're resetting the body's repair recognition and the body's immune recognition. The platelets' ability and the cell's ability to recognize that's a problem. I need to go back and fix that. That's a problem. That's a virus. I need to go clear that out. Because again, at this point in time, your body's coexisting with it. But you take this stuff out of the body, you reset that. And the way that I explain immune recognition is this. Imagine you live in a moldy house, but you don't know that it's moldy until you go to the beach for a couple of weeks and you come back and you realize there's a smell. That's immune recognition. So you put a high concentration, the right amount of dose of platelets back into the bloodstream. The one thing that's responsible for restarting these cascades to begin again. And that's essentially what is happening, is that these things are reset, and your body from a systemic perspective is able to take a look and say, I know that you came in here for the knee problem, but actually the reason the knee is hurting is because of this, this, and this problem, which you have no idea. So I'm going to circulating around because you gave this to me intravenously, and I'm going to go address this problem, and I'm going to go address this problem, and I'm going to address that problem because I'm the body, and I'm the one who chose how to turn systems off. You didn't. Whereas a medication that you're taking, okay, where that's different, A medication, you're going to measure the blood and you're going to determine with specificity that this is not working, that this is not working, that this is not working. And you're going to give a medication to target that specific thing that you measured that was off. But the body already knows that it's off. It's actually adjusted for that calibration. So when you give medications, it's not allowing the body to kind of figure it out. It's relying on something else externally to do it. But this treatment, what it does is you allow a systemic kind of resetting of the body's circuitry to happen. And so essentially what you have happen, let's see if I can give a different color. Essentially what you have happen is you're exiting back out of these inflammatory loops and you're going backwards. So at a high level, if you're stuck here, you're going to reverse back to a disease condition that you were right here. And then the next treatment, you just keep going and you keep going. Everybody's progress is a little bit different because age, diet, where you're at. I mean, all these things factor into it. But you can see right here, this arrow right here is meant to show this. If you're right here, you know, and I'm sorry for the color, but if you're right here at neurological decline and you look down here, you can get an idea of kind of the treatments that you'll need to heal yourself versus say someone who's right here and stuck right here with a viral condition or some sort of inflammatory condition is going to need less treatments. So, and I'll end it with this. So, does this treatment work? You know, well, how does it work? I just explained it, but you know, what is the treatment frequency? And does it work? And how does it feel like each treatment? Well, it's very rare that people don't experience something positive on the first treatment. It just might not be what you were expecting or what you came in complaining about at the doctor's office, because the problem is actually probably not even what you're thinking it is. It's just something that you came in to complain about that day about pain. And so each time that you're going through these treatments, about every 8 to 12 weeks, there's a kind of a reset and a new normal that's established. So if this becomes your new normal from this point right here, and you did a treatment and it kind of reversed you back to right here, this is your new normal. And the next treatment you get would start working that way. And this would become your new normal. So I'll stop right there and I'll kind of open it up. Sorry.
Okay, so I think we have a couple of different disease conditions or chronic conditions that I'm seeing represented. So I know we've got some chronic gut issues represented. We've got a long-term case of Epstein-Barr, some digestive issues, urinary issues, prostate issues, erectile dysfunction, brain fog. So I guess go from there.
So let me start with the Epstein-Barr because so let me see if I can share my screen again. And please let me know that you can see my screen. Can you see it?
Yep, we can see it.
Okay, let me get out. Just give me a second. So give me 1 second. Well, it's just, I'm gonna try it one more time. What I'm basically trying to show, I'm gonna try it one more time. Can you see it now?
Yep, we got it.
Okay. Digestive issue. Here you go. Oh, perfect. So if you look at kind of like conditions that involve, well, you just named it, fine motor loss, digestion, skin, fatigue, autoinflammatory. If you look at, if you don't look at the individual condition, you kind of look at the individual category, because the symptoms can kind of be this condition, that condition. And if you look at what underpins, I would say the majority of all of these conditions are pathogens, viruses, bacteria. You talk about gut issues. There's an imbalance of good and bad bacteria, pathogens. Mold, candida, fungus, Epstein-Barr, cytomegalovirus. These things are designed and built, and their existence is to manipulate our body. And the problem is that our ancestors and our grandparents didn't have the same problems with us, because they didn't live by the same ways that we treat things. My mom, when the neighbor got chickenpox, we had chickenpox parties so everybody could get it. But today we give shots. That is essentially dumbing down your body's immune system so it can't recognize friend from enemy. So what happens is these things build up, basically, ways that your body coexists with them, and they can't clear them. So we did a case report looking at patients who've received a TruDose treatment who had Epstein-Barr, had cytomegalovirus, candida, herpes 1, 2, 6, mold, Lyme. I mean, there's your who's who of things that lead to a lot of all these diseases. And we isolated it down to just 18 people who we could definitively say that had the TruDose treatment and didn't have high dose vitamin C. They didn't have any type of infusion. There was nothing else that you can say the treatment did this and nothing else did. So that was 18 people, and we looked at their blood data, at baseline and at 4 months. And at 4 months, these are the results. The 7 of the 10 people who had Epstein-Barr was serologically negative. And what that means is that when you measure these things in the blood, you obviously have ranges. If it's negative, but there's a value that it's still in your body, but it's not active. And then you have positive, and then you have the range where it's like, okay, that's the extent of the range. These people had so much in them that that the range stopped, and they had further than the range could measure. And what serological negativization means doesn't mean that you went to negative. It means that it's no longer in the blood. So it's wiped from the body. So 7 of the 10 people who had Epstein-Barr had serological negativization. Here you are for cytomegalovirus, candida, herpes 1, 2, and 6, mold, and Lyme. And so if you look at, and here's what was interesting. While the candida and the Lyme numbers aren't as high, the reason is because the viruses were more prevalent in these people's body. So there's no way of knowing this, but there's an assumption that the treatment was attacking the most problem child first, or in this case, the problem virus. But what was interesting is that 15 of these 18 people didn't have just one. So if you have Epstein-Barr, you don't just have Epstein-Barr. There's an 83% chance you have 3 of these things on here: herpes, mold, Lyme. And these things were all working together to do one thing, basically just put you in more inflammatory loops and to basically break your body down towards the metabolic tipping point. So, that's kind of like at the science level. How has this helped? I can tell you tons of stories of how it's helped people with gut issues, with skin issues. I can tell you tons of people that have had COVID long hauler with early stage fine motor, history of Lyme disease, and not just like Lyme, I'm getting better, but Lyme, it's no longer there. Erectile dysfunction, obviously erectile dysfunction, if you remember the chart, you had the 3 stages. Erectile dysfunction would be right there in the middle. So if you have erectile dysfunction, you're kind of close to getting to that metabolic tipping point where erectile dysfunction will turn into, say, something neurological at the next stage. It could be days, it could be a year from now, it could be 5 years from now, but that's the pathway. Does it help erectile dysfunction? Yes, it does. Yes, it does. It might be something where it might have to be a site-specific injection versus an IV. But the erectile dysfunction is not being caused by, erectile dysfunction is a metabolic thing. It's not a, you know, it's just it's not because it's not working. It's a metabolic thing that there's other things in your body that are causing the erectile dysfunction. Stress incontinence. If I had to put a watch on, and maybe money, if I had to go to Vegas and put $100,000 on what condition it would work 9 times out of 10, and I could set my watch to it, it would be urinary incontinence for women. Obviously, erectile dysfunction goes hand in hand with sexual dysfunction with women. The IV, what it does for that is, I mean, it's crazy, because erectile dysfunction and sexual dysfunction is not just aspects of, you know, the genitals not working. It's a connection here, because there's a neurological vascular connection that's causing those things. And so the reason that the IV treatment for, say, sexual dysfunction is so enhanced versus a site-specific is because the TruDose treatment has such a profound neurological effect on our body. And so when it comes to, say, sexual dysfunction, it really works. What were the other ones, Joanne?
I think you touched on all of that. Yeah, I think you kind of really did cover all of the stuff. Can you talk a little bit about your own personal experience and using it more preventively?
Yeah. So because of what I showed you on the chart, basically that chart outlines how we, unless you're going to live somewhere besides planet Earth, we are all headed towards that point of metabolic tipping point. We can prevent that, and I've kind of found the way to prevent that. But unless we go unless we go live somewhere besides the US, let me put it that way, because it's the foods we eat, the environment, the type of medical care that we've had for the past century has put us all in this position. It's not something that our grandparents had to deal with, their grandparents, and so forth. We are all in this inflammatory loop. And there's a reason why that 8 to 12 week mark exists, because that is the time point of where benefits start to plateau and where you start to establish a new homeostasis, a new normal. And on the graph, I showed you how you're exiting out of these inflammatory loops. And what's happening there when you establish that new normal, what is actually happening at the cellular level is what's called I had a question coming, sorry. It's basically rebooting this at the cellular level, it's memory. And so the analogy would be restoring your computer to a previous point in time before the virus actually invaded, like doing a memory restore. And so so when you do the treatment, it's literally restoring the cell memory and repairing the cell memory back to that certain time point. Now, and that memory point is being established and imprinted at the 8 to 12 week mark. That's not my data. That's data that's proven in the literature. So to your point, I personally do these treatments every 3 months because I don't have Epstein-Barr. I don't have autoimmune disease, but I've dealt with thousands of patients who have it, and I know how this reverses it. So I'm simply choosing, and I'm not, very strict on diets. I don't live a lifestyle where I'm in a chronic disease state. So, but I do this treatment because I know this is going to prevent me from sliding down that scale towards autoimmunity or autoinflammatory. Patients that live, in my experience, patients who come out of the Lyme disease, lupus, chronic inflammatory, whatever it is, they get to a point to where they're like, I feel great. I mean, and then it becomes kind of you listening to your body, whether it's the 5th treatment, the 4th treatment, the 6th treatment, you listening to your body, because your body will tell you when you have relapse. And that's the thing. Our cells, when we have this memory reset, your cells can relapse just like an alcoholic can relapse. If you become undisciplined and you eat inflammatory foods and go back to the same things, your cells can revert back to that old memory. I simply take this treatment so I don't go there. Patients, in my experience, who have chronic disease and Lyme, the majority of them just keep taking the treatment for the same reasons I just explained, because they know what it's like to live with a chronic disease. And it's like, if this is all it costs and I don't have to go back to that state where I was, then that's what I'm going to do. There was a question on the chat about, okay, the question's about, cancer. Has the treatment been treated for cancer, and is there any issues with promoting negative cell growth? So the short answer is yes. This has been treated for many people who've had cancers, blood clotting cancers, active cancers, dormant cancers. And what I can report to you on those patients is, well, number one, out of all patients, to date, there's no adverse events that have been reported, nothing negative. For these cancer patients specifically, the same thing, nothing negative has been reported. The only thing that I can report from cancer is that it's improved their pain. It's helped their pain. Cancer is the one condition where I would say deliberately not tried to do data collection just because it's such a polarizing word. The second part of the question has to do with promoting negative cell growth. Because platelets are not cells, they can't differentiate, they can't turn into other things. And nothing really within your blood does turn into other things. So there's nothing really cellular or compromising about it. Nothing that something could take it over and turning it into something bad. And so to that point, scientifically, it's really not possible. And I can report that it's not happened and promoted, metastasis or accelerated cell growth.
Awesome. So I think one of the folks that is not on the call, I don't think, so her husband has PTSD, didn't really know that he had PTSD so bad until he had a stroke. And now he really is stuck mentally with the PTSD and some of the issues that he's having with just the results of the stroke.
When did the stroke happen?
Within the last year. Oh, yeah, I think within 18 months.
Okay. I mean, you know why I'm asking that? Yeah, I mean, you probably do.
Yeah.
So, I guess you're asking me, how does this work for, things like PTSD and mental health?
Yes, absolutely.
So, can you see my screen?
Yep.
So, here's this chart again. And okay, where do I start? What I can say, what this does for mental illness, it's powerful. I don't know the word to describe it, but it's powerful. I've been in my share of girls that have been raped. I've been in my share of 2 weeks ago, I was in the room with a lady who had a stroke. For 30 years, after the treatment, she reveals to me that for 30 years, she had been trying to commit suicide as she's sitting next to her husband. And even she tells me that 2 days ago, she even actively tried, and her husband's crying right there. And she just had the treatment. And I pull this chart up and I'm explaining to her how the treatment, what it does for mental illness. What it does is it shifts them out of this. It shifts, we call it the shift, because for those people, for people that have had psychological impact, what happens is your body throws you into this feedback loop, but it throws you into this fight or flight state temporarily, while that, if you're raped, what happens is that event that's happening to you right then is a psychological trauma. And that event right there from that rape, what it does is it causes all this downstream things to happen to your body, whether it's your liver function, your gut function, I mean, the whole 9 yards. And so it immediately black boxes that event, whether it's something you saw in the military, getting raped, and in your body black boxes it. And it means to come back to and address it after it's already addressed all the fallout damage. But the longer that fallout damage goes on to address, this neurological connection to this black box becomes further and further away to where your brain cuts the cord to it. And then now you have this black box event in your head, even from your childhood, that is there. And whether you realize it or not, you are stuck in this fight or flight mode from there on out until you reestablish the neurological connection to it so you can detox it, because that event becomes equally as toxic as, say, Lyme, Epstein-Barr, some sort of neurological pathogen. You have to clear it. But you can't clear it if the neurological connection is cut and the body cut it as a defense mechanism. So what happens here in this graph, when you have that thing happen, your body shifts from an autonomic, you shift from the, you shift into the sympathetic, where your body is in this fight or flight. And when you get this treatment, what we commonly see, we call it the shift. It happens almost instantaneously. Your body will shift out of fight or flight, and your inability to have empathy, have connection, to have vulnerability, to connect on a deep level, on a soulful level, is now able to happen. And for this lady I'm talking about, I'm showing her this chart and I'm trying to explain to her exactly what I'm just explaining to you guys. And she stops me and she says, I'm 78 years old. I've been wanting to kill myself for 30 years. And her husband's crying. And I actively tried 2 days ago and he's crying more. She's like, I don't feel like I want to do that now. This is the first time I can remember that I want to live. And she goes on telling me how she's regretful, how the love that he gave her, she was unable to reciprocate because she was just simply stuck in this mode, this white noise. But now she's saying, I don't feel that. I have new eyes that I'm looking at him at. And I have this new, I don't know what it is that I feel for him. And it was just such a raw emotional moment. So, and that's what we call the shift. And I'm not saying it happens for 100% of people with mental, but it happens a lot, so much that we call it the shift. For people that have had PTSD, a rape, event that's trauma, like from war, what commonly happens with them is that event is often relived in their dreams that night. Dreams are no longer nightmarish. They're actually, well, the first night's usually a dream of the event that threw them into that PTSD event. And they are literally reliving it in third person or first person. And when I first heard this, I'm like, oh my God, this is awful. This is terrible. And so because you can wake up from the dream and you go back to sleep and you pick up right where you left off and nothing's crazy about it. There's no, there's nothing crazy about this dream. It's perfectly sequential. You can track it in your mind. You're literally, the reconnection is restored. And when they wake up the next morning, it's almost every person will say that I was able to wake up and I was able to really just set that event down like a bag of bricks, and I was able to walk. Now, obviously, from that point on is where kind of like real therapy happens and counseling needs to occur. But the point is that you can have all the counseling you want. You're unable to penetrate through to the core root of the problem because that person has been stuck in that fight or flight mode. This brings them out of it. I hope that answers the question.
Beautifully, and I'm trying not to cry because to me that is miraculous, and so I'm so thankful for that technology. For that reason, I think Casey has his hand raised.
Oh, I thought it was just a emoticon. Sorry.
Yeah, I mean, I was high-fiving you over here too, but I think he wants to ask a question.
Go ahead.
Yeah. Okay. One of the screens you shared showed 7 out of 10 people with, was it Epstein-Barr virus, showed a certain result after 4 months of treatments. So how many treatments are we talking in 4 months?
For that data that I showed you, it was 1 treatment, but the follow-up time point was 4 months. So they had 1 treatment. 4 months later, we measured their blood, and those were the results.
Got it. Thanks.
Now I will say, if I will say, I don't want there to be an expectation that this is going to be, wipe out all of my. Does this clear herpes? I got plenty of data that shows that it does. Does it do it in the first treatment? I can't tell you that because it's going to address the most problem child first. And that's just the way that, that if you just think about it, from a common sense, I'm going to tackle my biggest debt that I have of money first, and then I'm going to work down to my lowest debt. Kind of the body is the same way. So, if you have Epstein-Barr, herpes, and mold and Lyme, it's going to take basically a top-down view of what's the biggest problem child and what's going to clear it out. It might take the second or third treatment, but one patient that I commonly bring on these calls because her testimony is so powerful, she had Lyme, herpes, mold. She had the 9 yards. And it's powerful because a month before she met me, she has means, she has money, access to do all these alternative treatments. This is not her first rodeo. She was literally writing her will when she came to get treatment. And she's had, I think, 6 treatments now since last August. She doubled up a little bit. Her blood result is her blood panels, everything from her thyroid to all the pathogens, they're all clear, to the point to where she moved to Texas and now she works for my company.
That's so awesome. I know you mentioned vaccine injuries, but I expect that I'll be sharing this with some folks that are dealing with that. So can you speak to that? I'm sure it's the similar process of the pathogens, correct?
It is. And if there's anything that I would throw at it, I can relate to this because my 5th child was vaccine injured. And ultimately it was it was the inspiration for all of this, among a couple other things. But what I can say for what this does to vaccine injury, let's just take COVID long hauler because it's easy to talk about. A lot of stroke, a lot of blood clot, a lot of I got plenty of videos we can share. Heart inflammation, burning pee sensation, loss of hair. I think I already said stroke, but basically neurological injury. Within our platelets, we have all these kind of, think of platelets as kind of these army planes actively at any given point when something happens to your body, it immediately packs on all the weapons that it needs because the body gives it to them, or all the repair things it need for that given moment. And it disperses it. And because there's no cell component to it, it doesn't make it a really an easy target for, say, something like a virus. So a virus looks at it and it's like, you're not worth my time because there's no really nucleus part about it. So it makes them kind of the perfect thing in the body that it made to tackle these things. Well, one of the things that it's carrying inside of it is something called brain-derived neurotrophic factor. And that's a specific growth factor that it kind of gives out that's specifically responsible for nerve regeneration or remyelination. And when you think of vaccine injuries, they're all neurologically impaired. And when you think of viruses and pathogens, one of their main food sources is the myelin, which is the outer sheath of our nerves, because their whole objective is to try to access the nerves to get into our nervous system and to gain control of our command center. Well, when you put this treatment in the body and you have your platelets kind of working for you, let me see if I can back up here. What we've seen this do to vaccine injury is the same thing I'm telling you about all these other stories. There's an immediate, usually what happens to these people is they'll immediately feel it in the back of their head. You know, obviously that's where your brain is. Here it is. This is the graphic. This is from a study. This is just a picture to show you that at any given moment, platelets are carrying around these sensors that are specifically heat-seeking out these different viruses. God made us with all the intelligence we'll ever need. The only thing that you have to do is let it encounter it and let it acquire the intelligence organically. The way that we dumb down our intelligence is we give it vaccines because it doesn't allow for organic interaction of the platelets in the body and all of our immune cells to interact and understand, how is this virus attacking us? How is this vaccine? What's it doing to us? Vaccine is basically giving the body our instructions of what it is. And if you don't allow that organic interaction, then eventually your body, your cells become kind of like, what's the word? They just regurgitate. Kind of like you don't learn anything in class, you just regurgitate facts. There's no comprehensive knowledge. So resetting the body by doing this, basically, I'm coming up with a good one here, is resetting that kind of regurgitating knowledge back to comprehensive. And when you have that, especially with vaccine injury, the first thing it's going to want to address is neurological impact. I've got plenty of videos on stroke, plenty of doctors talking about how it affected them because they had to get the vaccine as part of their work. Yeah, it's as simple as your own blood can fix it.
I got another question. How often are you visiting the Tampa area? Are these treatments done when you're visiting the area, or how are they happening?
That's kind of why I'm on this call, is because the way these treatment happens is I've kind of been under a rock purposely, not promoting this and letting clinics who are doing these types of therapies and believe in the body, healing the body, find me. And I've been doing that through basically patients who are injured, have disease conditions, basically telling their physicians. That's how I've operated the past 5 years. Joanne is a great example of that. That's how she found me. And so once I kind of run into someone like Joanne, it becomes kind of a philosophical discussion. Hey, do you believe in the body, healing the body? What are you trying to do? And then this would fit perfectly in the practice that you do. Joanne, if I don't want to speak out of turn, but it just becomes, what types of therapies do you have? Because to have this therapy, obviously it does all these things, but you have to support it with all of the other types of things that that are kind of the body healing, the body treatments, IV nutrition, lymphatic massage, hyperbaric oxygen, whatever the different things that are kind of non-conventional treatments, but are the spokes of the hub. You know, this is the hub. Those are the spokes that this treatment must work well with. So you have to have someone like Joanne who can develop the treatment program specifically for what you're dealing with. And once I find someone like that, it's like, hey, let's get on these calls. Let's educate people. Let's help them make informed decisions. And then, so Joanne's in the process of evaluating this and, you know, potentially bringing this on.
Yeah, and really the Joanne's in the process of buying the equipment from Tapley and having him come and train me how to do it. So we can continue to offer this in Florida and for my patients in North Carolina and Virginia and Georgia that, you know, will make the trip down here because it's not available where they're at.
I hope that answered your question, Casey.
Yeah, appreciate it.
The reason that I've purposely rolled it out like that is because when you have something like this and you have the post-COVID era, this is something, if in my mind, if it was ever going to be successful, that it had to be something that the patients themselves had to embody and drive. Because only the patient who has been down the conventional route of medicine, whether it's themselves or whether it's the child with autism they're trying to heal, they have to get to a certain point and become so educated and so kind of, I've got to find another way. And that's where we're at, is you have people like Joanne and they're coming up all over the place. But if I would have done it backwards and not let the patient do it, I wouldn't have this kind of organic following and this really raw testimonial data, which is really where the rubber meets the road. Oh, there's a question on here. Does it help with arthritis or osteoporosis? Let's start with arthritis. Arthritis, yes. Depends on what kind of arthritis. Depends on the kind of arthritis will determine kind of the route of injection. If you have osteoarthritis, kind of a mechanical, I'm a runner and my knees are just bad and nothing else hurts in my body but just my knee, then that is something to where you'll get most likely a site-specific injection. Taking this out the right amount, stick it in your knee, and let's fix the problem. Go where the pain is. If you have rheumatoid arthritis, that's a completely different ballgame. That's a metabolic thing where your knee does hurt. It does cause wear and tear on the bones, but the problems are caused by a metabolic thing. Osteoporosis, again, does it help? How about this? Does it help with things that are age-related things? How about that? And is osteoporosis one of them? Because the treatment doesn't say I'm going to go fix your osteoporosis. That's not how this works. But because the treatment itself is taking a top-down view and saying you have Crohn's disease, you have lupus, you have Lyme, you have Hashimoto's, you have urinary incontinence, you have metabolic. I'm going to reverse you back in the order in which I chose to prune you down to where you are. And along the way, osteoporosis could be where it starts. It could be up here at the top. And those are all kind of age-related things. And as you saw on my chart where I was this downward slope, that's kind of also correlated with age as well, because we lose our ability to respond at a biologic level and to address these injuries fast enough. That's just age. So osteoporosis being one of those things that's kind of compounded by a whole number of factors: lack of this, lack of that, not of this. There's a whole number of reasons they're dysfunctional for osteoporosis. Does it help it? Yeah. If you were getting the treatment specifically for that, I don't want to give an expectation that it's going to do that, because it might actually help your vision and the liver function you never knew that was wrong. Since it seems like we're running out of questions, I always end this part of the talk with this. I always talk about what it does. See, did you have a question? I always talk about what it does for kids. Because we're all on here for for our various adult things, but what it does for kids is kind of unexplainable. Kind of like the story I was talking about with the PTSD. When I'm talking about well, obviously autism, various neurological things, cerebral palsy, dyslexia, learning disabilities. Oh, what it does for reading. Holy smokes. What it does for grade and aptitude, like your ability to learn. I mean, I have data on that. I mean, I've even treated, my two of my 5 children, they're borderline dyslexic, and they were getting the state exams and for reading. And for my oldest, it went from she was a kind of disorganized kid around 10 or 11, kind of struggled at reading, gave her the treatment for something else. This is early on in my discovery. And then when school started, a month or so later, I recognized, I'm like, holy cow, did you see her book, her backpack? Did you see how, I mean, it was filed and color coded, instead of just things just mashed in there. Her handwriting went from chicken scratch to like calligraphy. Her reading went from, on level to she was now getting tested for GT, and she was on the state exam, she was mastery when she took the test in the fall. My 4th child, the same thing. She was below reading level, the state exam. We did this last December, and I'm like, well, time to get her treatment because she tested below grade level. We got her exams, so we gave her the treatment in December. She didn't get they didn't retest her again until they retested everybody until May or whenever it was, and we got the results over the summer. And we got several emails from her teachers because she had achieved mastery. Now, I don't know of a program, we don't have my daughter in some sort of program, but that's not just my 2 kids. That's pretty much any kid that does this, because their brain responds so well. Their growth charts, they go from below the growth chart. Now they're exceeding it. We had to stop giving it to my 2nd child because she plays, at least for right now, because she plays high level competitive at the time soccer. And we had given her treatment the 2nd time, and it made her grow. I mean, it made her grow so fast she became gangly, and she's really, really fast. And every time I gave her treatment, it made her grow. And so she had to kind of like re-coordinate herself like a baby deer. So my wife's like, no more treatments. But what it does for just anxiety with kids, it's not, the word's not compliance. I don't know what the word is, but your ability to tell your child that's got a learning disability to go clean the room, and then for them to go do it, even if they do it unprompted. or to take initiative. For example, plenty of data points and stories about kids with learning disabilities that have the inability to identify, let's say, I don't know what the word is, but the ability to take responsibility when something happens wrong. Plenty of stories where it's, they did this and their friend covered for them like they always do. And then their son out of nowhere says, no, actually, I'm the one who did that, which is totally something out of left field. But the long and short of it is what it does for kids and brains and learning things, because all the kids today have brain and learning things that we didn't have to deal with. It fixes those. So there's a question on here about how about anaphylactic food allergies in children? That's one I can say, yes, it does help. And I don't want to say 100%, but it's dang near super high. All of these, when you have mast cell activation, when you can't eat any food because it throws you into anaphylactic shock. I can't tell you how many data points, including the woman who moved here and now works for my company. She couldn't eat anything, smell anything. Anytime she came into a room, it was like, she had to go running out of it. She had to carry an EpiPen with her everywhere. One of my interns had to carry an EpiPen. Plenty of stories of how this treatment immediately, your ability to, it resets that. It resets that antibody, that antigen response in the cells that throws us into those states. It resets it. So the foods that would throw you into this state where you can't eat, where you can't breathe, gone. And I don't want to say it's 100%. I don't know what the percentage is, but it's really high. So there's a question on here about Sjogren's disease. I'm blanking on the underlying causation of Sjogren's, but I want to say it's a microvascular thing. And the short answer is yes, it does help. There's another question on here about what would the next steps be to get treated? Well, the first step was to do this, and the next step would be to immediately contact Joanne on this phone call, on this Zoom, and get set up, because I think we're coming in the next week or so, Joanne, right?
Yeah, we've got a date set for July 15th, which is a Saturday. We're gonna have Theapy come from Texas and bring his system. And for those that are interested in moving forward, we'll get everybody treated on that day.
So that brings up a good point. If you're interested in getting the treatment, there's not a lot of things that don't make you not a candidate for this. But there are some kind of some broad level things you might want to do, or that you need to do. And just at a high level, and this is outside of whatever the personalized protocol that Joanne needs to kind of work you up and kind of say, okay, do this, because depending on if you have an autoimmune condition, there's certain things she's going to say, hey, 7 days before treatment, you're going to do this, 6 days before treatment, you're going to do that. And that'll be for individuals. But for everybody, you would need to go down to your nutritional store and get papaya leaf extract. And papaya leaf, they're vitamins. And basically you would need to start taking those. Joanne can help you with that. Those are going to help boost your platelet count. Again, you need to get with her so she can determine, what types of medications you're taking, what kinds of this and that. Because there's certain things that you need to stop taking. Like I was throwing, Advil, things that are kind of anti-inflammatory. You can't be doing those because it would impede this treatment. It would impede the body's natural process that's going to want to put you through and want to reset. And if you're taking some of those things, it would interrupt it. So just kind of a public service announcement that if you're interested, to get with Joanne so she can get you kind of, worked up.
Awesome. I don't think we have any more questions unless anyone on here has any more questions.
Well, if you want to have this video recording because you want to forward it on to one of your friends, whether they have a kid or whether they have a condition and they need to see this, I'm going to provide this link to Joanne. Joanne has some other links that I've given her that have, patients talking and doctor roundtables talking about various gnarly disease conditions that you can watch. Ultimately, this lives by you telling the next person to say, hey, this might be for you. And I think this can help you. And if that's it, I guess I'll close it down.
Yes, awesome. Thank you so much, Tapley, for being on with us again tonight and talking through some of these things and the wonderful examples that you gave. I am just so excited for having you and the system in my clinic and being able to really provide some help to people that have kind of lost hope.
Well, typing this message back. Hope is on the way. And it was always in you. It's in your own blood and you got a lot of it. So just think of it that way, that it's not something you're going to run out of.
Awesome. Thank you so much, Tapley. And anybody that has any questions, Stephanie, Casey, Kathy, I'm not sure who the iPhone user is, sorry. You guys reach out and ask me any questions that you can. If I don't know the answer directly, I have Tapley on speed dial and I can get the answers to those things. So I think that's all.
Okay, everybody. Thanks for joining.
Thank you.
Thank you.